And here we go. Okay, welcome. It is the last day of Allied Health Week. My name is Deneen Diamond. I'm here from the Center of Excellence for Health. We're so happy that you're here and you're tuning in. I had all kinds of teachers reach out to ask if Megan's session was going to be recorded. And yes, we are recording the session. And we are so blessed to have Megan, who's here from the New Brunswick Medical Society, that is going to share about her role in social work and her career pathway, which has led her down this road that maybe is not typical. And I believe that there are many opportunities for social workers, and she's really going to shed light on that from her own perspective and her own experience, which is so lovely and juicy. So without further ado, I'm going to hand it over to Megan.
Hi, everyone. Please bear with me as I share my screen. I'm really excited to be here today and chat with all of you about social work and about my path through social work. There we go. Okay. Come on, you. Of course, this was working 1 minute ago. There we go. So I'll start off with a little brief overview of social work because it was not my first career choice, but I'm so happy I found myself here. Social workers are allied health professionals. It's a regulated profession, so we have to be registered with the New Brunswick Association of Social Workers to call ourselves social workers, and it's such a varied professional employment, varied career. You can find social workers in almost any place that you look. And that's one of the wonderful pieces about it. So today I'm going to talk a little bit about me, how I ended up here, some skills I bring to this, my training and education pathway, a little bit about the work that I do, and hopefully we can end with a few questions. So that's me. That's my professional headshot. I remember vividly when I was about 15 or 16, trying really hard to figure out what a pathway to a career was going to look like for me. At the time, I think I was thinking about maybe a professional dancing. I was a competitive ballet dancer, maybe choreography. Also thinking about being a film director. I made some really bad, small scale documentaries. Um, but really feeling very conflicted about this because I had a lot of things that felt like they didn't align. I could be very compassionate and kind, but I could also be very fierce at times and very strong. And so trying to fit all of that into one career path felt very stressful for me. And as a result, my career path has not been linear. And I guess one of the messages that I'd like for you all to take home is if you're feeling in a similar way, if you're feeling like you don't really know what the good fit is, don't panic. There is a good fit out there for you, and sometimes not knowing actually makes that journey much richer. So professionally, I'm a manager, I'm a registered social worker, I'm a certified wellness professional. Personally, I'm a mom, I'm a wife, I'm a friend, I'm a daughter, a sister, all of those things. And the picture I posted here is from a trip that we took to Ireland this summer. This is much more me and my natural habitat with a backpack on and out hiking outside somewhere. Um, I have a lot of hobbies. I do a lot of different things. I have a lot of things that I'm interested in. I am a lifelong learner. I love taking courses. I love learning. It's part of my professional development that I have to do as a social worker, but it's also something I really like. And I have a lot of different hobbies. And as you'll see on there, they're quite varied as well. So I have some hobbies that are quiet and meditative and grounding. And I also have hobbies that are active and extroverted and outside. I will literally do almost anything you give me outside. In the summer, I kayak and hike and bike and run. And in the wintertime, I downhill ski and cross country ski and snowshoe and go sliding with the kids. And I love traveling and I love taking adventures. And it turns out that all of this variety, all of these things that don't seem to necessarily connect, actually in social work are huge assets. And that's because social workers, we step into things that are really hard. We hear really hard stories. We sit with people who are struggling, who are in pain, who have had really hard things happen to them. And if we don't take our self-care and wellness really seriously, we get sick too. So the risk for compassion fatigue, the risk for burnout is an occupational hazard in this line of work. It's not a guarantee though. So all of this variety, all of these like potentially contradictory things, they actually help me be a lot more intentional with looking after myself and intentional with how I understand wellness and plan my own wellness. So all of that stuff that happened when I was a teenager, where I was like, I don't know how all of these pieces fit together and I don't know how to find a career. Well, it turns out that that unity of contradictions is a massive asset to a career of social work. Social workers look at all situations through multiple lenses, through multiple levels. We look at individual factors, environmental or community factors. We look at system level factors. And we need to be very creative in the work that we do. And we need to help people find resources and help people get connected into the places that they need to be connected into. So having a wide variety of information, a wide variety of learning, these are huge assets and make social work a really good fit for me and any of you on the call who are like me. So as you probably imagined, my education and training was not linear. It took a long time for me to get where I wanted to go. And I honestly really wasn't thinking social work for the majority of it. As I mentioned, my pursuits in high school were very creative, very artistic, but I was fortunate enough to be in a very small high school with some very dedicated instructors and a really great group of peers and colleagues who sort of held the standard that post-secondary education was going to be something that would be really important. And in not knowing what I wanted to do, I started with psychology because I thought, hey, I'm interested in people. Let's see how people work. Um, and I went to a very big school. I started at University of Waterloo, and I went from a high school of 400 people to a university class of 500 people. It wasn't a great fit. I would definitely encourage people to take that into consideration when you're looking at post-secondary education. Um, and the courses that I really liked were all courses sort of around criminology, um, forensic psychology. That means something a little bit different now. Back then, it was really about sort of doing like crime scene analysis and making sort of criminal profiles, like doing criminal profiling. And I thought that was fascinating in my late teens and early 20s, and was really interested in pursuing that. But at the time, you would have need to do a doctorate to kind of be effective in that career. And I thought, I don't know, maybe that's a little bit more than I want to do. And I ended up, again, feeling a lot of pressure to sort of get that figured out at that time. And actually took a couple of years off in the middle of my degree, which is not a typical thing to do. Um, but for me, it was a really important time to sit down, think hard about what I wanted, figure out some things about lifestyle, work some really terrible jobs so that I knew I had to go back to school because I didn't want to stay working in retail. Um, and so I went back. I went back to York University. I was fortunate enough to get connected in with an incredible instructor named Dr. Michaela Hinia, who still works there. She's amazing. She let me volunteer in her lab running experiments for her research. She was my undergraduate thesis supervisor. And she was the person who really clued me into um, maybe doing some graduate work. She really believed in me and she really supported me. And we would talk about it. And she made the point at the time that was really, really, really important for me to hear, which was if you're interested in a lot of stuff and if you're good at a number of things, it is really hard to pick one thing. So don't force yourself to. Cast a wide net. Think about all of the different things you do. Having a nonlinear path can actually be a really important piece when you're working with people. Um, and so I started to seriously think about doing a master's. At the time, it was still very much a master's in psychology. Um, I was really interested in couples counseling. I thought that would be a really cool thing to do. I like the dynamics at play and sort of the pace of it. But if you are going to do a master's in psychology, you have to write an exam called a graduated results exam. And I did not want to do that. And you have to do a thesis. And I didn't really want to do that. And finally, the last piece was that you, with a master's in arts in psychology, at the time, you still were required to work under a psychologist, and that didn't have the type of autonomy that I was looking for. And so I started looking at job descriptions and looking at like what might be interesting. Where do I want to end up with this? And the Masters of Social Work came up over and over and over again as the preferred credential. This was in Ontario. And so I looked into it a little bit further and I was like, oh, this is really interesting. I like the coursework. I like what they're teaching. I think this is a really interesting kind of way to look at the world. It fits, like it's sort of speaking to me as a person. But because I'd taken a really long time off in the middle of my degree. And the applications sort of have to go out at the beginning of the year for graduates, and I didn't have the marks yet. I thought, well, I need a backup plan. So I did a diploma in human services counseling, which I think is also called social service worker now. That was maybe one of the best decisions that I have ever made because it's very skills based. And it gave me an actual marketable, hireable skill set to work in the field that I was starting to really feel very passionate about. Fortunately, the combination of those two things allowed me to get into a master's program. I went to Wilfrid Laurier and I did my master's in social work, and I loved it. And as I was doing placements in my master's, and that's one of the other things I really, really appreciated about the Masters of Social Work is that we did a lot of work. I left with almost a year's worth of experience, which makes you a lot more competitive in the job market. And it wasn't, although we rely a lot on research, it wasn't a research based, it was a professional master's program. And through that work, I became very intrigued with working in trauma. And I left thinking about working with trauma and crisis. And that at the time, there wasn't a lot of work at that time. And so I ended up at a wonderful place called Nova Vita Domestic Violence Prevention Services. That is in Brantford, Ontario. Their main claim to fame is Wayne Gretzky's from there. And they're very proud of it. And he has a winery there now, and they're very proud of that as well. My job here was my first taste of how varied social work could be, and how varied of a career you could do. So I worked one-on-one with survivors of domestic violence and sexual assault. I worked in groups, so I did therapeutic groups for survivors. I did therapeutic groups for seniors. I did parenting groups. I did art therapy there. And then I also worked a little bit in the court system, and I worked with perpetrators of domestic violence, both men and women who had been involved in the court system and were given the opportunity to attempt to sort of rehabilitate as opposed to go to jail. And so it was a really complex work environment. We had a lot of stuff going on. It was crisis and it was trauma, and I loved it. I worked there for a couple of years, and then my partner got accepted into a graduate program in British Columbia. So we moved to British Columbia. And there I was really fortunate again to find an incredible organization called Bridges for Women Society. And there they worked in a really interesting little niche role where we were working with women who had histories of trauma, and we're finding it a barrier to employment. And trauma does show up in employment significantly, and can create real challenges for people there. And so we had all sorts of programs. I did one-on-one counseling there. I also did a huge group facilitation and psychoeducation, a 6-month-long group, which is really rare. And at the time, I was registered with Crime Victim Assistance and First Nations Health Authority, and did some work with victims of violent crimes and also with women in First Nations communities, helping them develop skill set and working clinically with them. So I got a really wide variety of experience there. And then my husband finished his graduate work and got a job in New Brunswick, so we moved here. And I honestly wasn't planning on working here for a little while. We moved with a small family, a young family. And then this posting as the manager of New Brunswick Medical Society popped up. And I looked at it and I thought, oh, that's interesting. That could be a really interesting place to work. What a fantastic opportunity. But I wasn't ready for it. So I thought, oh, I can't do it right now. We just moved. Everything was chaos. We didn't even have our furniture yet. But it kind of played in the back of my mind. And then, fortunately for me, they hadn't found anyone, and it popped up again. And so I applied. And I'm so grateful that I did. I've been in this role for 5 years now. We've been in almost perpetual program development. My role is incredibly multifaceted, which again works really well for somebody like me who is interested in such a wide variety of things, and loves doing different things and loves not knowing what my day is going to bring. I never know what my day is going to bring. Um, and I get to do so many different things at this job. So I do program development, I evaluate programs, so I get to put together evaluation plans, I get to play with data. I do all the intake assessment, triage, referral. I do some counseling work here, and I manage, all of the programs. I've got a small team that I'm working with now, and I also work with committees. And so this has given me a incredibly unique experience, both for social work and for working in the healthcare field, where I am not really in I say we're sort of healthcare system adjacent because we don't really have a lot of authority in the healthcare system, but we work with it every day. And it's given me the opportunity to work with a really interesting dynamic population because all of my clients are physicians or medical students or residents. Um, and also have a huge impact within the system. So we've developed, I don't actually even know the number right now because we've been doing so much development work, but so many programs, and we're getting national attention for some of them. So that's really gratifying. But more so is the feedback that I get from the physicians where they say thank you and this is incredible and what a gem of a program and things like that. There are tremendous positives and negatives. I'm not going to be able to tell you about all of them. I'll tell you about some of the ones that I see here. Um, the positives are you really go to work every day as a social worker to make a difference in people's lives. And it is incredibly satisfying work to be able to help people heal, to be able to help them move forward with their lives, to be able to help them gain skill and self-efficacy and feel more confidence, and step into new healthier ways of being for themselves. Um, and the variety and the multifaceted nature of this work, and the ability to just sort of follow your passion wherever it leads you. I think a career in social work is unparalleled in the ability to do that. So there's huge positives around that. The negatives are it's a very demanding career. So it is something that unless you are feeling passionate about, I would think really hard about whether it's a good fit for you. There are some occupational risks associated with this, and including stress and burnout and things of that nature. So it's something that you have to kind of take seriously and do intentionally and do with purpose. Um, but if you can do all of those things, it is such a rewarding career. And I would encourage everybody to take a look at it. There's more skills than I could possibly enumerate that are associated with social work, but I think if you're starting in a career and you're interested in helping people, developing your ability to self-evaluate and have some self-awareness, understanding your skills and strengths in the areas that you find challenging, lots of empathy, leading with compassion is really important. And you need to be open to feedback and just willing to try. So a sense of adventure, a little bit of risk taking is really important. Um, Social workers are an incredibly collaborative group of individuals. We work on teams everywhere, all over the place. It is so rare, unless somebody's in a private practice where they just do clinical work, it's so rare to find anyone who isn't working as a group or as a team. And I have the benefit of being able to work locally all across New Brunswick with really incredible people and stakeholders. But we also have the opportunity to work nationally. So I get that perspective as well. We work with other physician health programs all across the country. And it's this really, really wonderful space where people share resources and they share ideas and they ask for help from each other. And we're all working to kind of help improve the healthcare system through help supporting our physicians. So if I'm looking back at this pathway, um, it was twisty, it was turny. I did not ever anticipate that I was going to end up in social work or in working in healthcare in this way. But I'm so glad that I took the risk to try all of the different things that I've tried because it's all added to finding myself in this like really wonderful organization in a really wonderful role that I find so, so rewarding. So I hope that this is appealing to some of you because there are many, many career paths available. You can find social workers literally everywhere. And it's a work that is passionate and dedicated and really, really rewarding. And so, oops, sorry, everyone. Got a little excited there. So, they asked about career advice when we were thinking about this. And I think my only career advice is consider it. Consider social work as an option for yourselves. They're like this patchwork on all of these fields. We all fit together and we all can do incredible work. There is a real appetite and desire for the skill sets that social workers have, in healthcare at the moment. There's tremendous potential to make huge impact in individual lives, in workplaces, and in systems. So listen to yourselves, trust your instincts, take risks, um, and hopefully I'll get to work with at least a few of you someday. And with that, I will end the formal presentation part of this and open it up to questions.
Awesome. Thank you, Megan. That was so absolutely lovely. Um, Very engaging. And I'm just going to let you know that 3 teachers have already emailed me to say that they couldn't get into the meeting today for some reason, and it has to do with their school. It's not something going on with their system. Anyways, with
Oh
that
dear.
said, we already know that the folks are waiting for the recording this afternoon. Um, I have a question, and you
Sure.
spoke about it really quickly, but it's something that I'm very passionate about. You talked about the heavy conversations that you have, or heavy situations, intense situations when you're a social worker, and I have a hard time figuring out, how do you folks? I know you talked about certain examples of what you do to make sure that you are well. Can you dive a little bit deeper into how important that is for students to hear?
Yeah, absolutely. It is in my opinion, a key professional competency if you're going to do this work, which means that this is something you have to know how to do. Um, so as a very early early green social worker, I worked at a women's shelter in Toronto. So as you can
Um,
imagine, that was a very busy place to be. It was a very multicultural place to be. The shelter staff within the staff supported or spoke over 30 languages, and needed to, because that was the diversity of the folks that we were working in. And it was the first place that I truly started to understand how hard some people's lives were, and how complicated, and how sometimes no matter what you try, you still end up in really difficult situations. And sitting in that as a fairly young individual, it was heavy. It weighs heavily on you. It actually had for me a bit of a physical weight that you sit, like you just notice your body feels heavier when you're sitting and talking to somebody about, some of the worst experiences that humans can go through. And I got some fabulous advice from shelter workers that had been in it for years. And they said, you can't fix it. They have to fix it. If you try and take all of this on yourself, you're going to go down, and you're not going to give these people the message that they are capable of doing this work. And I thought that was it was very powerful advice for me to get at the time, because I think, when you go in trying to help somebody, and you're overwhelmed, that's a kind of scary place to be, because
mhm,
you're supposed to be there to help. You're supposed to be there to fix things. But her point was really that actually your job is to be there to sit in your experience, and their job, and you're to support them being the best versions of themselves, whatever that looks like, because the people that are sitting across from you are capable, and they're responsible for any outcomes that happen. And they are strong and they are resilient. And your job is to hold that for them until they can hold it for themselves. So that was my first piece of advice around that, is really recognize that our role is limited. We're there for a short period of time. We're there to do a specific little piece of work. And people don't need to be rescued. That's not helping them. They
mhm.
need to be given space to figure out how to rescue themselves. or how to work through whatever they need to work through. And so that takes a tremendous amount of responsibility to step back. The other piece that I think is really, really important is going in with your eyes open and paying attention and not pretending like you have to be, bulletproof, or that you are not subject to the same stressors and like outcomes that other people are, right? Like social workers can struggle with our mental health too. We can get
You
depressed,
can
we
imagine.
can have anxiety, like we can have anxiety. And so you need to be a champion to that. So if you notice that, you have to sort of role model getting help, addressing it, going to therapy yourself if you need to, um, and also being really deliberate in the way that you look after yourself, right?
Yeah.
It's an important skill no matter what career you go into, but it's truly, truly important when you're brushing up against really, really hard things every day.
I agree 100%. No matter what role you have, it's certainly important. So, what I'm hearing is that we need to take, for the social work, especially, take the ego out of it, and not ego as in I am big and mighty, but ego as in I can solve the world, and really empower those folks that you're working with to say, you know what, this is my situation, but I can do X, Y, and Z to help myself. And it's not your responsibility as a social worker to cure them.
Absolutely.
Which I think is such a great message. So thank you so much. Again, I have 100 million questions, but I'm not going to hog the floor. Teachers who are listening, and I know you are, please take some time to maybe discuss the social work career pathway that Megan spoke about. And I know Megan is very open to questions. We've had questions coming in from students and teachers all week. Certainly, I do not answer those because I am not the expert, but I will pass them along to the folks that have been presenting. And if you're listening and you're looking for another session, we have one more session this afternoon at 1:30. But Megan, I'm going to hand it over to you just to say one last goodbye. But from the Center of Excellence for Health and Deneen Diamond, make sure you get outside and breathe beautiful fresh air. The sun's out today in New Brunswick. I don't know where you're listening from, but in New Brunswick, it's going to be a beautiful day. I even think it's time for a barbecue tonight before more snow comes tomorrow. So enjoy every moment, and over to you, Megan.
Oh, thanks. I second all of that. Absolutely. Please do all of those things. Um, and anything else that you feel like serves you. Thank you, everyone, for the opportunity to come and chat with you today. Sorry for the technical difficulties. That happens to the best of us. And I wish you all the best of luck figuring out your pathway to whatever amazing careers you end up with.
Awesome. Thanks so much. Have a beautiful day, everybody. And the